Okay, so we're quickly trying to talk about another type of osteoporosis today. So when we're initially talking about two types of osteoporosis, we said there's primary osteoporosis, which is due to aging. Then there's secondary osteoporosis, which is due to like an underlying disease condition. Okay, so this senile osteoporosis happen to be a subtype of primary osteoporosis, which is due to aging. Apart from the senile osteoporosis, we have the postmenopausal osteoporosis. That one we discussed it already. So let's talk about the senile osteoporosis. Of course, everybody knows osteoporosis, right? There's reduction in bone density. The calcium levels in the bone are going down. You get, right? So senile osteoporosis is like the second type of primary osteoporosis. Postmenopausal is the type 1. So senile osteoporosis is also known as what? Osteoporosis type 2. It is actually a form of age-related bone loss. Alright, so the density is going off. So it usually affects individuals that are above 70 years. That's postmenopausal is only in women. This senile osteoporosis could be in women, could be in men. Alright, so it occurs due to a combination of different factors. So sometimes maybe there's reduction in bone formation, sometimes there's decreased calcium absorption, sometimes vitamin D levels are deficient. Right? So those conditions on the whole, it just leads to what? Weak bones, making them more prone to fractures, especially in areas like your hips, your spine, your wrist. You got. So we have some risk factors, okay, that predispose to people to senile osteoporosis. So we have things like age, aging, you are becoming old, hormonal changes, like in women, estrogen levels are reducing. Even in men, right? There's poor nutrition, lack of physical activity, you are practicing a sedentary lifestyle, right? There's some certain medical conditions that you have had along your life. Then what again? It can result in complications like chronic pain, there's reduced mobility, there's an increased risk of mortality following fractures. So if you fracture, it can now become a complication. Do you understand? Because healing is what? So slow. Alright. So management just involve a combination of lifestyle changes such as weight bearing exercise. Okay. Your diet should be more of like calcium and vitamin D rich now. Alright, along with other medications just to strengthen your bone and prevent possible fractures that could come up. Right. So that was it for senile osteoporosis.